when something like Sandy Hook or Columbine or Virginia Tech happened, that we needed that flood that entire community with the availability of resources. And then that means being able to talk to therapists, counselors for children, long-term availability of these resources, not just for the, first few days or weeks after a shooting happens. And
Hello and welcome to the Hi-Fi Health News Podcast. I'm Erica Grotto. According to CDC data, every day in the United States, 120 people die and 200 are injured due to firearms. These events include not just headline-grabbing mass shootings, but also suicide, domestic violence, and hate crimes, to name a few. And for the survivors, family, friends, and community members, the aftermath can be difficult. Today, I'm picking up where I left off in the last episode with Dr. Dan Semenza, Associate Professor at Rutgers University and Director of Interpersonal Violence Research at the New Jersey Gun Violence Research Center at Rutgers. I asked him about the ripple effects of gun violence, and here's what he said.
This is where the issue of mental health resource allocation, I think, really needs to be addressed and kind of played up in a much bigger way. When there are shootings, starting with mass shootings, these kind of discrete traumatic events, the U.S. government and the federal government in particular has been recognizing that this essentially needs to be treated like a natural disaster. That when something like Sandy Hook or Columbine or Virginia Tech happened, that we needed that flood that entire community with the availability of resources. And then that means being able to talk to therapists, counselors for children, long-term availability of these resources, not just for the, first few days or weeks after a shooting happens. And that is one of the pillars of what the federal White House Prevention Office is doing, is that they have a component that is focused on, in the event of mass shootings, making sure that resources are flooded to these areas. And we can only hope that the federal office is able to maintain moving into the next, White House administration, so that work can keep going. But like everything else in this conversation, it's not just about that small number of mass shootings. The communities that have the highest rates of violence are often the least likely to have adequate healthcare resources for people who are exposed to that violence in terms of dealing with mental health issues as a fallout or a consequence of that violence. But again, this is where I am optimistic and I have hope. I think that there is an increasing realization that places with violence have access to this. And so in hospitals that are treating gunshot victims, for example, more and more hospitals have called hospital-based violence intervention programs, HVIPs. And these HVIPs are designed to help try and treat the patient to ensure that they don't retaliate, get involved in more shooting, and put them into a place where they can improve on their lives and get well and get healthy in all matters of health and well-being afterwards. And I think even further, there's an increasing understanding that we need to include the family and witnesses of that as well. That's newer, but this is one way where if you have a trauma center and you have an HVIP, say, let's make sure that everybody who's exposed is hearing where they can go get counseling, understanding how they can talk to a therapist or a grief counselor, learning about, CBT, cognitive behavioral therapy, and different things that have been shown to work for people exposed to post-traumatic stress, how they can use these in their everyday life. This is not just something people know naturally. It's something that you have to learn and be exposed to and know where to go to get those things. And so my hope is that we continue building out this healthcare resource. And there are increasingly more what are called trauma resource centers, TRCs. These are increasingly popping up in places that are providing access. It can be through medical providers, but here in Camden, where I teach and where I do a lot of my community work, it's through a social service provider, Center for Family Services. And those trauma resources are designed for outreach for people who've been exposed to violence. And one of the components is provision of mental health care, outreach, and resources in that way. So again, I don't think we have to limit this to a medical only setting, especially because some people are not going to necessarily trust the medical system, or they're not going to feel comfortable with a kind of traditional model of, talk therapy, and that we have to find other ways. But I'm confident that if we keep working on the progress that we've been making, that we can find these alternatives and make sure the communities and the individuals in those places are getting those access to resources.
Yeah, thank you for that. I'm reminded of a story that I heard Frank DeAngelis tell. He was the former principal of Columbine High School. He was the principal at the time of the shooting, and he said that the kids were out of school for something like 3 weeks after, and then went to Chatfield High School, which was a bit down the road. All the Columbine students went to Chatfield for the rest of the year. And the first day of school, they put up a big balloon banner to welcome all of the Columbine students, to make them feel happy that they were there, to make them feel welcome. And balloons started popping and kids started diving on the ground. And he said that was a wake-up call for him and for the school administration and for the community, that we don't live in the same world that we lived in a few weeks ago. And there are things that we didn't even think about were going to traumatize these kids. We wanted to make them feel welcome. And because of that, now they're traumatized.
Yeah, that's such a great example of the pitfalls of just relying on trying to address the problem after something has already, right? That you can't possibly predict how each individual person is going to respond to violence. You can't possibly know how an entire community is going to be able to get what they need. And you can't be doing it all of the time, right? All of this is resources and cost and money and time and effort. And that's why prevention, I think, is a much more winning strategy. Again, not to the detriment of improving mental health care access and resources. This should be a both and, not an either or situation, which, I'm not the first person to put it that way. But it's making sure that we don't just be reactive. We have to be preventative as well.
You've talked about kind of the layers going out from an event, whether it's a mass shooting, whether it's no matter what you're talking. And someone who is a victim, someone who is very close to a victim, someone who's a witness, they may look at themselves and say, I need some help. I need some guidance. What about those community members or somebody who's just seeing things on TV and they're feeling traumatized by this? Do you think people might have a hard time asking for help or seeking help or feeling like they deserve help or should get it? Or are there resources for people in those kinds of situations?
Yeah, this is where I think that proactive outreach is so critical, because there, I don't think many people would argue with the statement that mental health, mental illness, mental well-being, these things have been less stigmatized in recent years. I think that there have been lots of different forces at play, but that we realize collectively the importance of mental health, not just the absence of mental illness, but flourishing and being mentally well. We hear it in our workplace culture. We hear it on social media, and it's a big part of how younger folks are talking in the media as well. And so I do think that broadly, we have gotten better with being willing to ask for help or understand the importance of mental health. But that being said, it is still extremely difficult for anybody to ask for help, especially if they don't fully understand that they might need help, right? If their heart is racing or they're sweating every time somebody opens a door and they can't tell who it is, if they're having all these symptoms of hypervigilance and anxiety and depression, but they don't know how to identify those things, then how are you going to ask for help with something that you can't identify? Um, And furthermore, there are certainly people that are just, even if they do know that they're dealing with something, they just might not feel comfortable, right? They might not know who to ask. They might not know where to turn. And they might not feel that they can talk to a family member or friend because of residual stigma or because they might feel that they'll be looked down. In places that are dealing with a lot of shootings, they might have an HVIP in the hospital, or they might have a community violence intervention group, a CVI. And those groups are often comprised of people called interrupters. And those interrupters are people who are from the communities, often, not always, but often from the community. They know a lot of people who are from there. They have a lot of kind of legitimacy and credit for where they are. And they are out there trying to keep their ears to the ground and stop shootings before they happen, right? They're hearing about beeps. They're hearing about, who's mad at who's upset with somebody else, and, maybe who's thinking about retaliating for prior events, whatever it might be. And it is their job to go out and literally intervene and stop that conflict from happening. That is just the top line of the job description for a lot of these. And I know some of them quite well, having worked with them. Often they are the first line of resource for people who have been shot or lost family members or are living in fear of shootings all the time, to say, hey, this is where you can go and talk to somebody. Or like, hey, man, you shouldn't feel bad about needing to get some of this stuff off your chest. It might help you breathe a little bit easier, right? What you're going through, I went through 20 years ago. I know exactly what it was like. I've been there too. And so that is that conduit for getting people the help that either they don't necessarily know they need or they don't know how to get. And I think that this is a job that's been around for a while, but it's only recently been properly recognized as being as vital as it is, not being compensated the way as it needs to be. And the better we can develop a model for these kind of on the ground folks to do that kind of outreach that extends beyond just violence intervention, the more likely we are to be able to get people into a situation where they can get the resources that they need.
Yeah. So, you had mentioned, the impacts on gun violence between physical and behavioral health. I'm not sure what question I want to ask. What are your thoughts? What haven't we covered there?
Yeah, we've been focusing a lot on mental health, which I think is what's most intuitive to people. But and I've learned a lot, even in just the last 6 months or a year, writing a book on this, and in all of the very kind of biological ways that violence exposure has an impact on our physical health. And so, like I said, one of the big keys to this is understanding the effect of stress on the when we are stressed, either through like a really intense acute incident or chronically by, say, experiencing violence repeatedly or living in a community where that consistent threat of violence, that stress over time gets under the skin, right? It's, a little bit of stress is okay. A lot of bit of stress can be really harmful to our, um, and what that ends up doing over time is it creates what's called allostatic load or allostatic overload. We don't have to get too much into the biology, into the hormones of it all, but this has an impact on every major system of the body. It can alter the way that our brains develop, particularly in childhood. It can create inflammation in our bodies over time that can lead to immunodeficiencies that make us more susceptible to illness, to infection, and long term to chronic illness and disease. Um, and it can also impact what's called a process of DNA methylation, which is essentially it ages us. So when you are exposed to more violence in a frequent manner over time, and people have done studies to demonstrate this, somebody who has been exposed to violence at a cellular level, their bodies are older than somebody who is not experiencing. And so therefore their risk of illness and chronic disease also raises because they are genetically or biologically older than the counterparts that didn't experience violence. And so physically, all of this means, in the research that I've done, you have people who say when they're experiencing violence, cumulative violence in particular, uh, poor self-rated health, more days when they feel that their physical and mental health is bad, greater pain, greater incidence of chronic illness like diabetes, like obesity as well, and poor quality of life, particularly related to the physical. So all of these physical aspects, I think, extend to impact these differences that we have in racial and socioeconomic health outcomes. And that includes things, like I said, with heart disease and diabetes, but also in differences like cancer rates and infant and maternal health. So there are all of these ways that we can think about violence's impact on the body, physically, that really manifest in these major differences across the population that go far beyond mental well-being.
Are there resources that come to mind when it comes to if you're looking for mental health support, if you're feeling suicidal, if you're looking for support there? What can you recommend?
Given some of the research that we've been doing and that we're seeing about the risk of violence exposure and suicide, I'll first highlight 988, which is a suicide and crisis lifeline. This is available 24 hours a day. You can speak to somebody if you are feeling suicidal or just dealing with mental health issues and you need somebody. So this is kind of a first order, line. You don't need to go out and find a therapist. You don't need to find anything to do with medical or healthcare insurance. This is just somebody that you can call. If you are dealing with, violence in your life, or you've been shot yourself, or somebody who has been shot, you're living in these communities, then I think that some of the resources that I've already talked to are kind of a really great way of not having to do lots of research and figure out, who can help you through medical providers and stuff. But that hospital-based violence intervention program, hopefully at a local hospital or a local clinic, it might be operating, looking up resources through there, because it can give you the point person you need to then direct you wherever you're looking to go, right? That's their job. You have oftentimes an interrupter, an intervention worker, and a social worker that's trained to deal with this. But even if an HVIP is not available, there might be community violence intervention groups that are similarly more on the streets and less in the hospitals, that can direct people to the resources that they might be looking for. Ultimately, whether that is through a traditional healthcare provider or something else, it's often those localized groups, rather than just trying to Google or find things online, that'll get people the care that they might be looking for in the most immediate.
Thank you so much for joining me and for sharing your thoughts today.
Thank you so much for having me. I really appreciate it.